On this episode, we'll talk about how to convince your family for surgery. We'll also talk about smoking after surgery, and we'll talk about long-term complications. Hello everyone, I'm Dr. Alvarez from Endobariatric.com, and welcome to episode 81 of the AskDrA show. Thanks so much for submitting this week's questions, really good questions. And again, thank you for subscribing. Subscribe right there and follow me on Snapchat. We're doing a lot of cool stuff behind the scenes, surgeries, information, tips, and much more. The username right there. So let's get into this show.
How can you convince your family that sleeve surgery is safe and the right thing to do for yourself?
All right, so number one is try to convince your family for surgery. Number one, you have to be convinced because this is a totally personal decision. That's number one. Number two is most family members are kind of skeptical of weight loss surgery because they think this is dangerous for you. But it's real simple. Having that weight on you is very, very dangerous. It's actually more dangerous than the surgery itself. Surgery risk, that much. Not doing surgery, that much. I mean, it's that simple. So all you have to do is turn to your family members and tell them, this is the risk. Carrying this weight is the risk. Going through surgery, the goal of surgery is giving you better quality of life, making you lose a lot of weight, inches and sizes, and just getting healthy all around. So that's simple.
Is it safe to smoke after surgery?
Smoking after surgery, when can you resume? In our practice, we don't recommend you go back to smoking, but let's say you just can't stay away from the cigarettes, 21 days. So the first 3 weeks, which is the healing process, which is the most important time frame, you need to take care of that sleeve because the smoking does irritate the inner layer of your stomach and it gets it swollen. We want to put the fire out, not put fire in, all right? So 21 days, then you can resume the smoking. But again, if you're going through a major transformation, a procedure that's going to transform your life all around, might as well get your life tuned up nicely.
How far out can people who have the surgery have complications?
All right, so complications down the road, no, they're not frequent. Normally, after your stomach has healed, again, the 21 days, you don't see any complications down the road. No complications down after 5 or 10 years. I mean, there are some, in literature, we do have patients that have had problems or seen problems years after, but not related to the sleeve. So once your stomach is healed, don't worry about down the road, but do take care of that tiny stomach, all right? It's not like your stomach's gonna burst open 5 years down the road or 10 years down the road. Your sleeve, once it's healed, it's your stomach. Just take care of it. So that's it for episode 81 of the AskDrA show. Just to let you know, volume 2 of the AskDrA book is out on Amazon, and we can place the link on the description area. So if you want to check it out, buy it. It's also available on for your Kindle. But a lot more questions, a lot just compiled into one book. We've got volume 1, now volume 2 out there. So in case you want to check it out. I'm Dr. Alvarez from Endobariatric, where we are changing lives one sleeve at a time. Take care and God bless.